Hi everyone, this video is to talk about our IV catheters and to demonstrate why some blood leaking may occur when you're starting an IV. So first, let's just review our IV catheters. Our IV catheters are supplied by Smith's Medical. The 24 gauge, the 22 gauge, and the 20 gauge catheter all have the valve inside the catheter hub, as well as a flash view window in the needle. The 18 gauge catheter and larger have the valve inside the catheter hub, but there is no flash view window. So let's talk about starting an IV and using the catheters. The flash view window plays an important role, and when you're starting an IV on a difficult patient or on a very small vein, this flash view window gives you early confirmation that you've entered the vein, and then the flash will continue up into the chamber to give you more confirmation of venous entry. So be mindful of that flash view window and use it to your advantage when starting those more difficult IVs. So when you're starting the IV, you watch for blood in the flash view window, followed by blood into the chamber. Then you advance the catheter into the vein and the needle into the needle housing. This is where some of the problems may occur. So right now, the flash view window is here. The valve in the catheter hub is here, where these ridges are on the hub itself. Because the flash view window is on the patient side of the valve, this is a closed system and no blood will leak. As you advance the catheter further and retract your needle into the housing, if you pause or move slowly while the flash view window is on the other side of the valve, venous pressure and other things may cause the blood to leak out, either into the needle housing or between the catheter and the needle housing. So right now there's blood leakage, and when you notice it, the best way to get it to stop is to quickly move the needle all the way into the needle housing to close the system. We can disconnect now from the catheter, and you'll see the valve in the catheter hub is engaged, so no more leakage from the catheter or the vein. You can then attach your extension set and move on. If you want more of a visual aid when starting your IVs, you'll notice that these finger push-off tabs on the catheter and the needle housing are a good indication of where the flash view window is when you are starting your IV. So the first finger push-off tab, as we move our catheter off the needle and we come to this first finger push-off tab, you'll notice that the flash view window is here. So it's still on the patient side of the valve and within that closed system. Once you start moving past that is where we need to be a little bit quicker and move the flash view window quickly into the needle housing to close that system. So Smith Medical suggests a push, pull, click, disconnect technique when starting your IVs. So we will cannulate the vein, observe for flash in the flash view window, followed by flash in the chamber, and then advance our catheter into the vein and do a quick push off the needle and pull into the needle housing. The click is an audible confirmation that the needle is safe within the needle housing and you can disconnect. There's no sharps. And the valve is engaged now in the catheter hub, so there will be no further leakage from the patient. And you can again connect your IV extension set and continue on. Hopefully that's helpful, and if you have any further questions, don't hesitate to contact the education department, and thank you for watching this video.